Welcome back. In today's lesson, we're going to explore how cultural beliefs and social norms shape the way depression is perceived and treated across different parts of the world.
Depression is a universal experience, but its recognition and management vary greatly depending on cultural context. Understanding these cultural differences is crucial in ensuring that individuals receive the right support and care, especially when they are from diverse backgrounds. Let's start with the concept of stigma. One of the most significant cultural factors influencing how depression is perceived is stigma. In many cultures, mental health issues, including depression, are often seen as something to be ashamed of. Mental illness can be viewed as a personal weakness or a sign of failure, and individuals experiencing depression may feel isolated and reluctant to seek help because they fear being judged. In parts of Asia, for example, mental health issues like depression are still highly stigmatized. In countries such as Japan, South Korea, and China, individuals suffering from depression may hide their symptoms or avoid seeking treatment because of the fear of being seen as weak or unfit for society. This stigma can create significant barriers to accessing care, as people often feel pressured to maintain a perfect image or conform to societal expectations, which may include avoiding any display of vulnerability. On the other hand, in more Western cultures, there has been a shift in recent years toward greater mental health awareness and acceptance. People in places like the United States and Europe are more likely to seek professional help, such as seeing a therapist or taking medication, and discussing mental health openly has become more normalized. However, even in these societies, stigma persists, especially for certain groups, such as men or older adults, who may still face cultural pressure to conceal emotional distress. Reflection. Questions. How does stigma influence how people from different cultures approach seeking help for depression? In your community, do you think there's more acceptance or stigma surrounding mental health? Next, let's take a look at how depression is explained and understood in different cultural contexts. In many African cultures, depression may not be seen as a medical condition at all. Instead, it might be explained through spiritual or supernatural beliefs. In some African communities, depression is believed to be caused by evil spirits, ancestor displeasure, or even witchcraft. Because of this, individuals may seek help from traditional healers or religious leaders, rather than mental health professionals, to address their depression. This is not to say that traditional healing is wrong. Many traditional healers are highly respected and play an important role in communities. But it can lead to delays in receiving the kind of care that can help treat depression effectively. Similarly, in many parts of India and South Asia, mental health struggles such as depression are sometimes attributed to karma, the belief that a person's suffering is a result of their actions in past lives. In these regions, people with depression may turn to family and religion for support, rather than seeking formal treatment. Family support is often a critical part of the healing process, but at the same time, the focus on family honor and societal expectations can make it difficult for individuals to talk openly about their struggles. This can also affect how depression is expressed. For instance, depression in East Asian cultures may be manifested more through physical symptoms than emotional ones. In China, for example, depression may present as chronic pain, fatigue, or headaches, symptoms that are more accepted and less stigmatized than expressing sadness or hopelessness. In such cultures, people may seek help from a general physician for their physical symptoms, but might be less likely to talk about their emotional state. Reflection. Questions. How can cultural beliefs about the causes of depression influence the type of treatment someone seeks? What are some examples in your own culture where depression might be misunderstood or treated differently? Now let's discuss the role of family and community in different cultures. In many Latin American cultures, for example, depression is often viewed through the lens of family dynamics. Familismo, the cultural value of family togetherness and loyalty, plays a large role in how mental health issues are addressed. For many Latinx individuals, family support is the primary resource for coping with depression. there is an emphasis on collective well-being over individual needs. And therefore, emotional struggles are often shared with close family members who provide emotional support. However, this strong family focus may also mean that individuals might avoid seeking outside help, particularly from mental health professionals, if they feel it would bring shame or burden to the family. In Middle Eastern cultures, similar to Latin American cultures, family involvement is key in managing depression. However, there may also be a greater focus on religion. For example, in countries like Saudi Arabia and Egypt, religious leaders or faith-based practices such as prayer, meditation, or fasting may be used to help manage symptoms of depression. Islamic teachings often emphasize community support, and individuals who are struggling with depression may be encouraged to rely on spiritual guidance and community solidarity rather than seeking medical treatment. Reflection, questions. In cultures where family and community play a large role in supporting mental health, how might this impact someone's decision to seek professional help? How can we balance cultural practices with professional mental health care to ensure effective treatment? Finally, let's talk about treatment approaches in different cultural settings. In more Western cultures, treatment for depression typically involves therapy, medication, or a combination of both. The use of cognitive behavioral therapy, CBT, and antidepressant medications are common approaches, and mental health professionals are widely available to help individuals with depression. The general approach is based on a medical model where depression is seen as a condition that can be diagnosed and treated scientifically. However, in non-Western cultures, there may be a stronger emphasis on holistic or alternative treatments. For instance, traditional Chinese medicine, TCM, often incorporates herbal remedies, acupuncture, and dietary changes to help balance the body's energy and treat depression. Similarly, Ayurveda in India uses a combination of diet, meditation, yoga, and herbal treatments to restore mental health. These approaches are often used alongside or in place of traditional Western treatments. In many cultures, however, there is still a lack of mental health professionals trained to address depression in culturally sensitive ways. The shortage of professionals, along with cultural stigma and financial barriers, can create significant gaps in care. Reflection, questions. How might culturally specific treatment approaches be more effective for certain populations? What are some ways that healthcare systems can improve their ability to treat depression in a culturally sensitive manner? As you can see, depression is viewed and treated in very different ways across the world. Understanding these cultural differences is key to providing effective care and ensuring that individuals receive the support they need in a way that respects their values and beliefs. In the next video, we'll explore how co-occurring disorders like anxiety and substance abuse are often present alongside depression, creating additional challenges in treatment. Let's keep it going, and I'll see you in the next one.